Hi, I'm Carly, and I thought you might like to know where my career in community services has led me and what I'm doing these days. So, I am a manager in the community health organisation in regional Victoria, and my actual title is called Manager of Community Connections. And I mainly work in the aged and disabilities sort of area. I manage 4 different programs in the community health service. The first one is a volunteer service, so matching volunteers, individual volunteers who would like a role, and also supporting organisations who like to have volunteers as well, and so with their recruitment and any training and support that they need to make sure that they're doing all the right things for their volunteers. Another program is called Access and Support, and it's actually just a one-person program, and that worker is referred anyone who's kind of fallen through the gaps. So, and it may be for all sorts of reasons. They need to engage with aged care services, or they have a disability and are struggling to apply for the NDIS, or just need information about it, or they have a mental health condition that's actually a barrier to them accessing different things. And so that's an outreach program, and they help them link into whatever they need. That's the second one. The third one is NDIS support coordination. So obviously a brand new career path for lots of people working in the NDIS space, and we started that program up from scratch in 2017, and it's just gone gangbusters since then. So that's working with people who have an NDIS plan, who have been identified as needing a bit of extra support to implement their plan. So we help them we get the referral of their plan, we have a look, our workers look through the plan to see all the different services that they've applied for, and they've been successful in receiving some funding to get those services in place. And then they work with them throughout the plan period to get them linked into everything that they need, so connected to community and whatever they need to live an ordinary life with a disability in the community. And the fourth one is called social support, and that is mainly for people who are over 65 and have barriers to accessing the community in some ways. So we provide small groups up to 6 with a staff member and a volunteer on a bus, and we plan all sorts of activities and things so that they can connect with each other, and they can also find out what's going on in the community and access that and have an enjoyable day out together. And that is really designed around what the person wants. So we get feedback from them all the time. We are surveying them, we're talking to them. We have a little book in the bus that anytime someone mentions something, when they look out the window or they say that they would like something, it's written down and we put it into the planning. It's quite an involved process around that as well. So my job is to oversee all 4 of those programs, and the other one is a project that I do on the side, which is a community choir. So I was successful in some funding to start up a choir that is accessible to everybody, so in the community. So whether it can be for anybody. But it is sort of focused on building a community from scratch. So what I've been able to do is we have a really nice blend of people who come, some who are full-time workers, and then some who are on a disability support pension perhaps, or older people in the community who have come together. And the model actually really supports us to build this little community from scratch and foster relationships between each other, and then promoting through our performances that we are available to such a wide range of people, because it's obvious when you see us all together that there's a real mix of people there. And that's been a really nice connection to the community as well. So Working in regional Victoria really gives us there are quite a lot of differences to being in the city. First of all, there's just such a lack of services available for people, so there's a lot of gaps. And also we really pride ourselves on being a place-based service. So in the local community, accessible to people who live around here without having to travel to the big cities to get their services that they need. Unfortunately, a barrier to that is a lot of funding is often, and seems to be a real trend, pushed to the bigger organisations and the bigger cities. And so grants that we go for and projects that we want to get started, we often really struggle, even though everybody seems to know that this is a real problem. We struggle with trying to get those funding, and often our grants go to the bigger cities, and it's just so disappointing, especially if someone has a mental health issue or a disability or is socially isolated, and transport and travel is such a barrier to them accessing services. So social isolation is such an issue that can really affect people's mental health, and that's pretty well documented. And they're the sort of services that I look for, or that's the clientele that I'm looking for, really. But it's very hard to find them. I have a partnership that I'm working on at the moment with our social support program and the small bus outings. We have been successful to link with an LGBTI organisation called Switchboard in Melbourne, who have been looking for partners to help promote activities for socially isolated, older people in the community who identify as LGBTIQA+. We do a lot of work in our organisation with youth in that sector, and it's been really quite eye-opening to learn about the extra difficulties that senior LGBTI people face living in communities and not necessarily feeling like it's a safe place to access a particular service. So we always have trouble trying to locate the people who would like to come out on our small outings. But now we've got the extra push really to try and find people who are even more socially isolated and identify in that group as well. It's been a really interesting piece of work. Now with the coronavirus pandemic all around us, this week has been particularly busy because for the people who are particularly socially isolated and the work that we do to actually get them out and to connect them with their community and with others, we're now encouraging them all to socially isolate again. And we know how vulnerable they are already. So it's been a big week of trying to work out where we fit with that. So to go back through the different programs I work with, I'll give you an idea of the sorts of things we're putting into place as of this week, and that could all possibly change next week, but I think it's useful to hear anyway. So our volunteer service, working with people, we've seen quite a number, especially in the first week of the pandemic information, a lot of people calling and saying that they would like to volunteer. People are coming from the heart. They really want to help people. But then we need to have processes in place for volunteers who just want to come in the community and do something in a really short term, or to go and help people who are vulnerable, because it's not necessarily, we can't just send people out there. There's a lot of risks that we have to mitigate as well. So we're in the process at the moment. Our first call was get our own staff safe and make sure we're doing all the right things. So we've got the coordinator of the program is going to be working from home, self-isolating, and the volunteers that come in to help run that program are actually not going to be coming in for a while, and some of them can do some work that are where it's more web-based and not actually client-facing work. We have volunteer hubs set up at libraries, and the libraries are closed, so we're not going to have that available. We also need to talk to all the organisations who have currently got volunteer positions advertised, because with a lot of organisations not able to work with people, then we have to just see if they're still looking for people. Some are, like some of the bigger organisations that do help vulnerable people are looking for volunteers, and others just need to put a hold on all of their recruitment of volunteers at the moment. So we're just working through that at the moment and finding out where volunteers can go and offer their support. So that's been quite a lot of work, just sorting that out and getting those processes right, and finding out what the neighbourhood centres are doing, and other resources in the community that are popping up, and seeing how we can support them and see how what we can do to support them recruiting volunteers, and where we can send volunteers to. So that's been quite big. Now, volunteering also from a mental health perspective is a fantastic way to connect with organisations in it, especially where there's a point of interest that someone might really like, and they might like to eventually work in that field, or just have the experience of being in that area. So we understand that a lot of our volunteers that do come through may have a mental health condition. Some of them are also may be on Centrelink and need to have 15 hours of volunteering as part of their Centrelink plan or their New Start allowance, and we support that too. Our access and support worker sees a lot of mental health. So whether it's in the aged care sort of area, person is really struggling to get onto My Aged Care or find referrals, leave the house, all of those kind of barriers that mental health can bring up. And also with NDIS, the mental health side of NDIS has been really difficult to navigate to. It is a little bit better than it was to start out with, especially if someone has a mental health diagnosis that is deemed permanent, and they've got the paperwork to show that. It's a little bit easier. But we do find if someone has been knocked back from NDIS just because they haven't used the right language, they've tried it themselves, and they've been knocked back twice, 3 times, it really does affect their ability to keep on trying. So our worker does quite a bit of work around that too, and to see if they can help link them into the local area coordinators and the community linkers that will actually help them through that process. We see a lot there too. Support coordination is a whole new kettle of fish as well. So the person's obviously been identified as not being able to, for whatever reason, manage all of the coordination of their plan. And sometimes the mental health issue or can be underlying. It might not even be part of their official diagnosis. Or it can be, we also see quite a bit of mental health in parents or carers who are living with the person who has the NDIS plan. So we might be working with the person to get them linked in, but we can see that the extra burden and stress that the NDIS process, especially around reviews or if plans have not been adequate the first time, can really have on the carers as well. So we have to be really mindful of that and have the skills to be able to navigate the other people who are associated with the person who has the plan. So that can be quite tricky too. And then in social support, older people who are still living at home and isolated, not have any access to transport, can be really difficult too. And I suppose that's something that regional Victoria, that's something that we see a lot. So not having access to transport and getting out to doctor's appointments or just to the community, not easy to get out to shops, not easy to go out to cafes, to the library, all of that can be really difficult for people. So that's what we can help with. So while we have an activity that might be to go to the local library to learn how to use IT, or recently they did some work on Ancestry to find out the resources in the library that they could use to do that, or the neighbourhood house, what activities are happening there, or just going out for lunch somewhere. We usually try and bring in an activity as well as a food option, so they generally still get lunch, but it might be while they're out on an activity that they've decided is good. And we try and get in some physical activity while we can too, because that always helps with mental health too. So we've had small groups playing croquet, table tennis, going for walks, all sorts of things. Whatever the participants say that they would like to experience, we try and build that in. So now this week with support coordination, I didn't talk about what we're doing this week. So all of our face-to-face meetings have stopped, and we are doing a lot of phone contact, and that's okay unless you have someone who's non-verbal or just doesn't use a phone, or there's a whole lot of barriers to just using phone contact in support coordination. So we're working through our lists of who is the most vulnerable, people who are living in, say, group housing with other people and another organisation involved, perhaps is less at risk than someone who's living completely alone and relying on supports coming into their home. We are trying to work out, yes, if the person with the disability ends up with coronavirus, what do we do with the support workers who may not be able to come in and see to their everyday needs? That is an issue that we are working through. And then, of course, if the support organisation that sends support workers in ends up closing, where do we get other ones from? And that is very difficult to be working through. We know NDIA are doing phone reviews and meetings for the time being as well. So there's no face-to-face contact there, which could mean that needs are not picked up. So the risks around that, we're working through on a case-by-case basis and tackling what we need to there. Social support, we've actually had to cancel all of our outings in the community. 50% of our participants in this group are in their 80s and 90s, so deemed to be the highest risk to if they were to catch the virus. So we are working through what we need to do to keep in contact with them and to find out what resources. There seems to be initiatives popping up everywhere at the moment, so we're keeping a list of what we can find to help them through this time, whether that is actually connecting them with each other. So asking them if they would like to speak to another person that they normally come out with, which could be really actually a positive thing in the long run. We haven't done that before. They see each other each week when they're out on the bus, but actually encouraging conversations outside of that time. We also have our staff are calling them and trying to assess the needs also on a case-by-case basis. We don't want to just send out food parcels to everyone when that's actually not necessary, and that could also be a bit patronising if we did that and they have family that are looking after them or coming or whatever they're doing. So we're working out how we can support them the best way from home, because all of our staff now are working from home. So, and how we all connect together, and it's a bit of a minefield, but it's been a pretty interesting week trying to do that. Our choir has also stopped meeting, but we're looking at Zoom meetings for our choir and doing that remotely, just so that we can connect people, because we have started this little community that is really benefiting from catching up each week and all the mental health benefits of singing and using your voice, and all the there's lots of health benefits that have been well documented about doing that too. So it's been a very interesting week, and it's a very interesting job being across the board with all of these different vulnerable sectors in the community. Hopefully that's given you some insight and will help you with your studies. Good luck with it all.